Hi, Heather here from HMB Training Services. I'm delivering this training on behalf of Sunshine and Little Stars. We are going to go through CPR and choking a little bit later on. Baby, we're going to go through, and child, what the difference of the age difference and how old is a child when we go into and treat them as an adult. We are going to go through and I want to treat it like a little bit like first aid training. So when I go through first aid training, I'll go through my letters, doctors, ABC. What do they mean? So when we have got a casualty who's not breathing, we need to obviously stay calm, and today you'll have the knowledge and understanding actually what do we need to do. Somebody is not breathing, what is the steps and what do I need to do? So when I go through my letters, Dr. ABC, you might forget them, but you may be aware, and when you are in a life-threatening situation, your mind might be going overdrive and you're thinking, okay, what did I learn? What did Heather teach me? What did that first aid trainer teach me? What is it that I need to do? And hopefully you'll recognise actually they're not breathing and these are what I need to do. Okay, so the first thing that we want to check is our D out of Dr. ABC. So D is checking the area, checking your dangers. Obviously if there's water or electricity items, they need to be out the way. Your children might be a danger and they might be crying, or it might be the other adult that they are panicking, and I have heard stories of adults, parents are actually panicking and doing things that they shouldn't do, or moving the child or putting some underneath the head. If that is the case, just give them a job to do, especially if it's a child in distress. Just say, go and wait for the ambulance, or go and get me a tea towel, or I don't know, go and get me some toy blocks, that will really help me. Okay, so distraction is a key. So once we remove the dangers, we need to recognise if they are breathing and the steps what we would do. So the next one is R, which is our response. We are going to check our R, and after the R, what is R is response, is tapping them and talking to them. So we've got Junior here and we're tapping them on the shoulders. We can give a little bit of pain, a little pinch of the skin, see if they respond to it. If we are giving pain, just look at the facial features and see if they react to it. Okay, so with a baby, obviously we're not going to tap a baby. We can tickle their feet or tickle the hands or tickle in between and see if they respond to the tickling. Once we have done the response, it's important, actually, is there anybody in the house or in the vicinity that are actually available that they can actually help? So we're going to shout for help. And it is important to have extra help with us, and it could be you've got an older child, it could be that you've got the adult and they're upstairs or somewhere in the vicinity, or you can hear somebody in the garden, you can shout for them, or you've got somebody next door that you can actually open the door and shout. Having extra help will be fantastic, especially if you're on your own, because they can go and get a defibrillator if needed. So shouting for help, or if you recognise when you're touching the response, the C is circulation, and we're checking the circulation to see if they're actually with us and not showing any signs of shock or hypoxia. That is pale skin and blue tinges to the skin. If it is a dark skinned child, a Caribbean type child, and you can't recognise that they're going pale, just look inside the lips. And that area will be showing that hypoxia, that cyanosis, the pale skin and the blueness. If at that point you know an ambulance is need to be called, at shout you can be calling an ambulance. Yes, the first question they will be asking you is the casualty breathing, so hopefully once you've got through the next two steps, which is airway and breathing, they should only take about 15 seconds. So you can say, I'm not sure if they do ask you that question, or you say, I'm checking now and they don't feel like they can't feel breaths. So, may need to call the ambulance or shout for help then, but we're going to check the airway. So checking the airway is hand on the forehead, hand on the chin, and we tilt the head back. So let's show you better. So forehead and chin, and then tilt the head back. What we are checking for the airway is anything stuck in there in the throat cavity. Obviously stuck in the throat, we're not going to put our fingers through, but if we know there's an object stuck there, you need to start doing the choking treatment, back blows and abdominal thrusts, or baby chest thrusts. Or it could be sick, and what we also do is there's no objects in there, but also it's important that tilting the head back will alleviate any of the tongue on the throat. So I'll bring this a little bit forward so you can see. So normal position, if we just tilt the head back, the tongue will come up, so then the airway's free. So at the moment the tongue's blocking the airway, and it could be just tilt the head back will be enough to open up the airway. So that's another reason why we need to open the airway. So the airway is open, and then now we need to check for if they are breathing. So how to check that they are breathing? So the airway is open. So airway is open. What we want to do is checking for breathing is listening for breaths on the cheek, in her ear. So listening for breaths in our ear, feeling it on our cheek, and then we're going to look down, put a hand on their chest, and then what we would do is see if the chest is moving. So head back and listen, and we do that for 10 seconds. So there's no breaths there. So what I need to start doing is circulation. Okay, so the rule of thumb when we are, so the next letter is the C. So the rule of thumb is recognising that they're not breathing. If you have not called the ambulance, we need to start calling them as soon as we recognise they're not breathing. And so with a child, now the age of a child is age 8, but there's no upper age limit anymore. We used to say it's at the age around about 8. At the moment we say, because our 8-year-old's more like a 10 and 12-year-old, and sometimes our 8-year-old's like a 6-year-old. So you're looking at their torso, and if they are around about the age of 8 and they're showing signs of puberty, as to say, is then we treat them as an adult. However, if you think actually it doesn't harm the child to do the child method, now it doesn't matter what age they are, what condition they've had, like choking, drowning, heart condition, it could be a stroke and whatnot. Many years ago it used to be 15 and 7 here, and you do 2 breaths here and 5 breaths there. What they've done, because people are getting really confused, they say now that any age, whatever's happened to them, is always 30 compressions and 2 breaths. So doesn't matter what age they are, it's always 30 compressions and then 2 breaths. Now with children, it's always going to be a respiratory problem, it's a breathing problem, it's a lack of oxygen, and you need to get that extra oxygen into their lungs. It's very rare it's a heart problem, or it's a cardiac arrest or something like that. It's usually with breaths and with compressions, it's enough to restart a child or a baby's heart and put them back into the breathing motion. There is that very low percent that a defibrillator is needed, and what a defibrillator does is stops that abnormal rhythm and puts that rhythm back into that heart back into rhythm. If there is another adult, so when you ring the ambulance, they'll say, no, what's your emergency? Ambulance, please. Are they breathing? No, they're not. They'll say who it is. Then they'll say, is there somebody with you? Can they go and get a defibrillator? We can use a defibrillator on a child or baby. However, the ambulance service will be wanting to know how long you've done CPR for, and also what is that defibrillator? Has it got child pads, and has it got a child setting before you're allowed to use it? So follow the instructions, what the ambulance service says. Right, so we've done, so we've got this casualty, they are not breathing. What we need to do, we establish that they're not breathing. We're going to, if we're on our own, the book recommendation is that we do 1 minute of CPR on our own. 1 minute is roughly 2 cycles. So for that 1 minute, we'll go straight into CPR, so straight into compressions, then do 2 breaths, 30 compressions, 2 breaths, 30 compressions, and then ring the ambulance. As a mom, what I would do is get my phone, put them on loudspeaker, call 999, and I will be doing compressions until and then if I can get 2 breaths in and keep on going, and then until the call actually fades, then that's when I'll do my 5 breaths, and I'll do 30 compressions, 2 breaths, 30 compressions, 2 breaths. If there's an adult with you, absolutely bonus. They will be calling an ambulance and we'll get straight into 5 breaths, 30 compressions, 2 breaths, 30 to 32. And we keep on going and doing CPR until a few things, they wake up. And if they do wake up, put them into recovery position, which I'll be doing on the next video, the next session. And then also, the ambulance arrives, and if the ambulance do arrive, just because they come through the door doesn't mean that we're going to stop. We'll stop when I take over and say, thank you, mum, parent, I'll take over now. Or if you're physically exhausted, your adrenaline is going to pump you to the point where you are going to be absolutely alert, just like a meerkat, and the stood up going. You're going to be absolutely alert. You're going to have lots of adrenaline pump through you, and hopefully you are going to keep on going. If there is another adult with you and you're a bit tired and your arms are hurting, just get them to take over for a few minutes, and then you they say 2 minutes, which is roughly 4 or 5 cycles, and then you can continue again. Right, so I'm going to do junior, and then I'll go through the methods of baby. Okay, so I'm going to go through my Dr. ABC again, and I'm going to see if they work here so you can see them. She says, so you know what I'm going through. Hopefully they'll stay there, and hopefully you can see them. So my first thing is check the area, so check my dangers. So I've checked my dangers, then I'm going to check their response. So Harry, can you hear me? Harry, give a bit of pain. Harry, if you can hear me, open your eyes. So give him an instruction to do. So they're unable to do what I've asked. I'm going to, so my shout is here somewhere, so I'm going to shout for help. Is anybody there that can help me? Once I've shouted for help, then what I need to do then is check that the airway's clear. So forehead and chin and head back, looking in there, nothing in there at all. And then once the head is back, normal person, the head will stay back. So I'm going to check for breathing. So listening, looking down, feeling for breath on my cheek, see if the chest is rising. For 10 seconds, I can't hear anything, can't feel anything. So then it's clear that I need to do my compressions and enhance the circulation. While I'm thinking about it is, and it's one of the questions that may be asked, is pulse. Is pulse needed? Checking for pulse. You know what, while you're checking, so pulse, we don't do that in first aid anymore. So as a first aid trainer, we don't be asked to actually check for pulse. By the time we've tried to find the pulse and establish there is a pulse or not, what happens is that it directs us from what we should be doing, if that makes sense. So and it takes too long to check, and if there is a pulse, and do it properly. So it's usually 2 fingers, not your thumb, and we can check. By the time we try to say is there a pulse or not, within that 10 seconds with the head back, within that 10 seconds we can actually establish if there's a pulse or that they're breathing or not within 10 seconds. If you feel more reassured that they are not breathing and you want to check for pulse, there is nothing wrong with that. But don't let that direct you from checking and doing the correct checks. Okay, so we establish that they're not breathing, we call 999, my partner or whoever's called 999, but they're on the way, or you called them. We're going to do the 5 breaths. So with the breaths, with a child 12 months and upwards, we need to put the head right back, ensure the head's back and the airway's open. If the air is not going to go through, important that we're going to check that the chest is rising when we are doing breaths. So head is back, squeeze the nose so there's no air escaping from the nose, make a complete seal around their lips. You should see the chest rise. So I'm going to do 5 of those. That's 3. That's 4. And that's 5. So I've done my 5 rescue breaths. Now it is CPR time. It's important to use the heel of our hand. That heel of the hand goes on the sternum, which is between the nipples, Another direction, another thing that you can do is the bottom of their ribs. So their ribs are here, just sitting on top of the bottom of the ribs with your 2 fingers, and then you can put your hand, and then that hand should be sitting directly in the middle of the chest. So my hand would be there. Now it's important that we are using our body weight. At the moment my wrist is not in line with my shoulder. So if I tilt my head, my body weight right forward, now my shoulder is sitting with my hand. Okay, so we're going to use, I will compress, but I'm not going to do CPR efficiently, so I need to use my body weight. Much easier, be able to compress the chest efficiently and accurately. Okay, so child then, so we want to do my 30 compressions. If this child's a bigger child, we can use my other hand as weight. If I can't do it and I'm struggling and they're a bigger child, interlock our hands and then we can then be able to do it correctly. So how many compressions how fast do we go? So we've got to think that we've got a song in our head. We're not going to, if you want to, you can sing the song, but we always think of a song so we can put us in the right rhythm. So we're not too slow and we're not too quick. So we want to be just so. So we've done, when we're doing CPR, we've got to think we're going to do 2 compressions per 1 second. So that's quite quick. So it's 1 and 2 and 3, 1 and 2 and 3, 1 and 2 and 3, and that's the beat that we want to go in. The songs that we can think of is Staying Alive, Nelly the Elephant, Sing Her Twice, that gives us 30 compressions. We've got loads of other songs like Twinkle Star or Baby Shark. As long as you've got that rhythm in your head and you are counting, then that should be enough. So, using my technique, on my knees, sitting up, body weight forward, and then it's 1 and 2 and 3, 1 and 2 and 3, 1 and 2 and 3. So that's 9, 11, 12, 13. Don't know why, but I can't count to 30 when I'm doing CPR, so I count to 20 because I think when we're going 21, 22, 23, 24, I just think it's too long of a number, so I'll go back to 1, 2, 3, 4 and do a 20 and then do a 10 in my head. It is important to go deep enough, so we've got our body like so, it's 3rd depth. So a child is 5 centimetres, a baby is 4 centimetres. Obviously I'm going deep enough, my mannequin is going to click. So it's important that it is deep enough. If you're doing CPR correctly, you will break a rib, the saying goes, but in a children, the bones are more flexible, they're still growing, they're bendable, so the likelihood of breaking a rib in a child or a baby is very unlikely, but it can happen. If you hear a rib break, just carry on, you're doing well, you're doing a good job, and you've got to think, if I do break a rib, I'm doing it correctly. Okay, and that's scary as it sounds, but that is how it goes. So I've done my 30 compressions. I'll go back now and do 2 breaths. That's 1, and that's 2, and then I'm going to do my 30 compressions. So that is one, I've done complete 1 cycle. So we keep on going until the ambulance arrives. So that is my child. Baby is I'll say completely different. We've got lots of different things to think about with a baby. So I'm going to bring my table. We can do baby on the floor, but they say that we might be overbearing and we might do more damage. So we can put a baby on a table, or we can keep her in our arms. Okay, so I'm going to demonstrate on my little table. So with a child, we say that we can squeeze the nose. Now if we squeeze the nose on a baby, my fingers are going to get in the way. So what we do is my mouth covers their nose and mouth. Their airways, their lungs are like tea bags. So all we do is give them enough breath, like blowing out a candle. So it's, and that's enough, and that's how much we need to do. Hopefully you'll see chest rise, but all I'm doing, as the saying goes, is breath is slow and steady, compressions is hard and it's fast. Say fast, we're not going to go fast like that, it's do a little bit of a pause in between is enough, but we're not going slow, so that's too slow. Okay, so that's the saying, hard and fast for compressions, slow and steady for the breaths. Okay, so I'm going to go through my doctor's ABC again. So go through my danger. Obviously it's a baby, we can pick them up very quick. Response, tickle them, see if they respond. You can tap them, see if they respond. They're not making no noise. Airway, now airway in a baby, if we put the head right back, it's the opposite effect. We're actually, what we're doing is closing up their airway. So a little bit back is enough. Supporting the head because they're going to be a bit floppy, so we open up the airway, we're going to look in, nothing in there, nothing objects, no marbles or any objects in there. Then I'm going to check for breathing, so it's the same as a child, be listening, looking down, feeling the chest, can't hear or feel anything, and then I'm going to do my CPR. Call for help, shout for help, get them to call. If not, we do a minute of CPR on our own. So that's my 30 compressions, do my 2 breaths, 30 compressions, and then call. Once we've done that, a phone call, they're calling us, and even if I think if you started the heart and it worked, I'll still be calling an ambulance, just to get them checked out and make sure they're okay. There's a reason why they've stopped breathing, so peace of mind, call an ambulance, I think I would. Ambulance is on their way, still not breathing, and then what we would do then is 5 rescue breaths. If somebody's calling the ambulance, we go straight into rescue breaths. We don't need to do that 1 minute. If you feel better, you're doing CPR for the first time and the ambulance is not being called yet, by all means do the 5 breaths. If you have forgotten the 5 breaths, again, you're doing something, and eventually air will be in, oxygen will be in the child or the baby's lungs. So ambulance is being called. So head is a little bit back, so 5 breaths, cover nose and mouth. Okay, that's 1, that's 2, 3, 5. Now doing compressions, we're looking between the shoulders and the arms, and then it's a little bit down. So we've got our arms there, and it's just take a finger space back. Okay, so support the head because I'm going to be a bit floppy, and then we compress then 4 centimetres. So 1, 2, 3, 4. If it is a bit hard, we can use an extra finger to help us. So that's 10, 11, 12. Okay, and then I'll go back to my 2 breaths. So head back a bit. 1, and that's 2. And then I'll keep on going. Okay, hope that helps. So don't forget, danger, check the response, airway back, check the breathing, check the circulation, they're not breathing, circulation is very pale, call for an ambulance. For the first, if you're on your own, a minute, so 30 compressions, 2 breaths, 30 compressions, 2 breaths, and then you'll call an ambulance. If you've got somebody else calling, then you'll call, they will call, and then get straight into the 5 rescue breaths. Just an added thing, if you wanted to do the baby and CPR in their arms, the head was naturally be in the natural position, so the head will be back and the airways are open, so we don't have to worry about the airways. So we check the danger, do response, checking in the airway, nothing in the airway, check for breathing, and then you can do CPR in your arms. Okay, if you have got a baby, what you can do Just go to the front door and open the front door, and you can open it, and you can actually do two things. Do CPR, be right next to the door, so when the ambulance do arrive, they can take over extra quicker than trying to find you within the house. Okay, so that's baby. And what I want to go through, and I think this is important, it's knowledgeable. You might not use it in your lifetime, but at least then you know what a defibrillator is and what it does and where they are. Defibrillators are stored in a yellow box, in a key code usually. If when you call an ambulance, they'll say, oh, you're on your own, is there somebody with you? And then they will tell you where the defibrillator is and the code to get into it. So if you're worried about, well, actually I don't know what the code is, they will tell you what the code is. In the pack, within your defibrillator, there is a small little pack. In there is a towel to dry them, so if they are sweaty for whatever reason, shears to cut up the garment, and then also a CPR mask also. All defibrillators look different sizes, different shapes. There are some defibrillators that are fully automated, so when you open up the defibrillator, it'll start talking to you. It'll say check the dangers or check the response, or it might go straight in. Remove clothing from the casualty, and then it'll say apply pads. So mine is a training one. It has got buttons, so some will have buttons. So this one has got an on switch. Some might be semi-automated, so they you have to switch them on, but they'll give the shock for you. You can never give a shock, so it's obviously it's on now, and I want to give a shock. It'll never give a shock out. So that's the other thing. That's the important thing, is you can't go wrong. They're foolproof, and they'll talk through with you, and you just can't go wrong. Okay, so I'm going to switch it on. I'm going to use my mannequin here. Now where the defibrillator, the pads go, the defib pads go, on an adult, so you got your heart here, one will go here underneath the shoulder blade between the nipple, and the other one will go here. What it happens is these two pads communicate one another, and they go through the heart, and it's the signal and the shock through the heart that stops the heart, and then it restarts. With a child, their torso is just too close. The pads, they're too small, and the pads are too close. It's not efficient enough. It doesn't give out that signal through the heart, and it misses the heart. So to get it through the heart correctly, it's one pad on the front and one on the shoulder blades. If you won't be on your own when you've got a defibrillator, you do not go and get a defibrillator if it's just you on your own. Once you start CPR, you keep on going. There's no interruption, a little interruption as much as you can. So you would have somebody with you, so you would roll them forward while the pad's been attached at the back, and then you would then continue with CPR until the defibrillator tells you to stand clear, do not touch the casualty. Okay, so I'm going to put him that way. So I'm going to put on the defibrillator. Let's move back so you can see. So I'm going to put the defibrillator on. So it's telling me it's an adult.
If the patient is a child,
it's not
press
an adult.
The child
it is
patient.
A child, so I press that.
Remove the child's shirt.
So I get my shears.
Remove packet and apply pads onto child's bare skin.
Packet, and they're great because they show you exactly
apply pads
where
to child's
apply
back
them.
and chest as shown in the pictures.
This one's at the front.
Press pads firmly on skin.
And then this one is on the back.
Apply pads to child's back and chest as shown in the pictures. Press pads firmly on skin.
So rub them firmly.
Do not touch the patient. Analyzing heart rhythm.
Okay.
Do not touch the patient. Analyzing heart rhythm. Shock advised. Do not touch the patient. Everyone clear. Press the flashing shock button.
So now my shock button is pressed.
Press the shock button
so
now.
Press that. That gives a shock.
Shock delivered.
If it works,
begin CPR.
They'll start opening their eyes and breathing and communicating, and you can see them swallowing. You see the chest rising
10,
in a regular way. If not, then we need to start doing CPR. So
20.
this defibrillator clicks, and every click is
30.
a compression.
Give 2 breaths.
And eventually it'll give you a breath. So some defibrillators will tell you, so some defibrillators count in clicks, some will just flash, some will just click, some will click continuously, some might pause, some might count and pause. But if they don't pause, then just keep on doing your 30 and remember to do your 2 breaths. So I'm going to just do one cycle for you. I'm going to take the clicker off the mannequin, do a cycle to show you what you would do when the defibrillator is working. It's great because I don't need to count now.
10. 20. 30. Give 2 breaths.
Okay. So defibrillators, I said them in a yellow box. Sometimes they're inside a supermarket, inside somewhere. So my community centre's got one in their foyer. Schools may have them in the office or in the hall or in the medical room. Big Tesco's have them by the customer services. You might have them inside a shop. Sometimes they might be in disused phone boxes, so they might be there as well. So they could be anywhere. Churches outside, community centres, little shops, one-shops, co-ops, little village shops or something like that. They will be there as well. So I hope you have got something from CPR. If there's any questions at all, then please email me. The email's in the description in this video, or just comment, and then if I don't reply and it's been a couple of days, then just give me a nudge and email me. But any questions at all, please do ask. I hope I've covered everything, but anything that's unsure or you want me to just discuss it, I am here. So feel free to call me. I am open, and if there's anything at all that you want me to go through again, I am happy to do so. Okay, so hope you've enjoyed. I hope you got something from it, and more reassurance if your child or somebody that you know or somebody in the street is stopped breathing, you know exactly what to do. Just very briefly, if it is an adult, you do exactly the same as a child, but don't do the rescue breaths. So you go straight in, do your 30 compressions using your 2 hands, leaning forward, and it's the same sequence, it's the same rhythm, and we do the 2 breaths and we keep on going. For an adult, you do, before you start CPR, you get the ambulance on the way. So call for the ambulance first and then get straight into CPR without any interruption as you can. Okie doke. Hi everybody, right, next up we're going to do some choking. So we're going to go through a child 12 months upwards and then a baby 12 months and below. So newborn to 12 months, and then I'll show the technique, what we would do for 12 months and upwards. Okay, so choking is very, very easily done, and they can choke on a marble, food, objects and stuff, and then we have also got liquids like milk. Now, when we're talking about food items, grapes should be cut up in half. So we've got an oval in half. While we're cutting them in half, we might as well cut them in quarters. Mini eggs are the same shape as a grape, and it's coming up to Easter, but be mindful when we have got mini eggs that they are the perfect size for that object to get stuck in their throat, and it does come with a warning that under 3s you do not give them. Okay, so how and why does a child or a baby choke? So their esophagus, which is their feeding tube, is really right next to their windpipe, and it's very easy for food to go down the wrong way. When a child is being weaned, so what they're doing is they're learning how to swallow, how to chew, and how to use the tongue, and how to use the muscles within the throat. And by doing while they're eating, so when they get to 6 months or 5 months, when you start weaning them and giving them a whole food, we don't mash anything anymore. Well, they do recommend us to actually give them the whole foods. And what they'll do is put it in the mouth and then they'll chew, and you might hear them make a noise, and what they're doing is gagging, and what they're doing is trying not to let that food go all the way down the throat without it being obviously chewed up. So they will gag. And gagging, also we would do, also doing is using the muscles to, and then they might bring it back up and they're making noise. With choking, and if choking is happening, they're unable to make a noise. So they'll be very silent and they will start to go blue. And it's very important to help them very quickly, because their oxygen levels will be massively reduced very quickly. So going back to a story of mine, my daughter was 7 months old. I was sitting watching the telly with a bottle of milk on my lap, bless her. And when we was on the lap, watching telly, having her bottle, and the next thing I know, that she wasn't sucking her bottle anymore. So I just looked at her and going, what's the matter? And she was going a bit floppy. She was able to sit up at that point. And I noticed that she kind of having the reassurance of me, and her lips were turning blue. So you would think on a milk bottle of all things. So I put milk bottle down, and when we think of, oh, if that happened to me, I'm gonna panic. I'm gonna be really, really like terrified, and I'll be running around the room. So with my story is I was fixed on my seat. I couldn't get up, even if I wanted to, I couldn't. And lots of messages were going through my head, thinking, what do I do? Do I go next door? And within seconds, I was actually leaning her forward. This is not the right thing to do. I'll show you the right format. But at that point, this is a good 10 years ago, at that point, I leant her forward and I started doing back blows. What's going through my mind is, oh, I'll call my mum. What's my mum going to do? You know, in my mind, I was screaming around the room, but I was fixed on the seat. I was dead calm, and I'm thinking, I'm on my own. I need to do something, and now. So I leant her forward, supported her jaw, leant her forward, and then I started doing a back blow. So I went like that. My brain was going, Heather, you know, harder. So all of a sudden I went whack her on the back, and then she was able to be sick. So I will show you the correct format, and if this happens to you, you know exactly what to do. So, you know that the baby is blue, and you know actually, or the child's blue, and they're not making any noise, they need some help from you. Right, so there's two formats of choking. There is mild choking, where they're able to make a noise, they might be gagging or sorting it out themselves, and they're able to do, and they're making a noise. I'll probably be right next to them, ready to do a back blow, and if they're able to talk, say, do you want me to help you? Do you want me to give you a pat on the back? They might say, no, I'm fine, Mum, just leave me alone. Or my dad, you know, leave me alone. Okay, so if they're unable to make a noise, and they're really pale, and they're struggling to breathe, and they're either pale or they're turning blue, they need some help from you, and very quickly. Okay, so we're choking then. So I have mentioned baby and child and older person. It's important that we do not do abdominal thrust on a baby. We use 2 fingers, just like CPR. Child, we're able to use the fist, the abdominal thrust method with our fist, and I'll show you the difference between the two. Child 12 months upwards, we use the thrust method, and what we are doing is making a fist, and that fist sits between the belly button and the bottom of the ribs, so in the abdominal area there. What we're doing, the fist there, and we're pushing it there, and our hand then will go over the top. And what we're doing with this fist, I want to show you properly, is it's going to go in and then up. It's not going to go it's going to be a swift, fast movement. So fist like so, hand, and then we're going to go like that. I'm not going to do it on myself because it will hurt, and what we are trying to do is get the diaphragm to burst a blast of air. Basically we're winding the casualty. Right, so we have got my abdominal thrust person, this is Fred, And this balloon here is imitating what it'll be like when you are winding a person. So this is Fred. I'm going to ask Fred, are you choking, Fred? He is choking. He's very blue. He looks like he's struggling to breathe. I do need to ask him though, can you cough? Try and encourage them to cough and see if they can actually bring it out themselves. So he's unable to cough. So 5 firm back blows is what I'm going to do first. I'm going to support him on his chest, leaning forward. Gravity is great and it's really ideal to do, because if we keep him upright and we're doing back blows, if the object comes out, it's going to sit in his throat cavity, and when he starts breathing, they're going to go, the object's going to go back down again. So it's important to lean them forward. If it's a child, can lie them on the lap, make sure that they're going down in their downward angle. Okay, so supporting them on the chest, 5 back blows. So 1, 2, 3, 4, 5, and we're using the hand and firm back blows, and that's between the shoulder blades. Done 5 of those. It's not worked, so I'm going to do my 5 abdominal thrusts. Fist in the abdominal area, hand over, leaning forward, and we're going in and then up. So like so. So I'm not quick enough. Come on Heather, let's do it faster and quicker. Okay, so that's come out. So in and then up. It's quite quick. Okay. So it's come out with the child, come out with 2 abdominal thrusts, so I don't really need the ambulance. However, if they're struggling to breathe, difficulty in swallowing, or persistent cough, or feeling of something stuck in their throat, and you've done a abdominal thrust, you just go and take them to the doctors. They'll just explain what's happened. They'll check the area and make sure everything's okay. Now, they've done 5 back blows, 5 abdominal thrusts, and it's not worked. It's still not lodged, and you do need some help. So call for an ambulance and then keep on going until the ambulance arrives. Okay, so what I want to do now is show you what to do with the baby. So, difference with baby is they are choking. We're not going to say, oh, you're choking, baby. Obviously, they can't talk. Clearly, they are choking. They're going floppy. They're going very blue. They're going, and they can't make a noise. They're not crying. So we do need some help quite quickly. So, supporting the door, leaning forward. Ideally, you'll probably be leaning down and leave them on the lap. So the purposes of this video, so we can see. So support them nicely, ideally on your lap, and we're going to do 5 back blows. Important that the baby is in a downward position. So 5 back blows, so 1, 2, 3, 4, 5. Turn them over, support the head still, downward position, and we're going to do a chest thrust just like we do with CPR. So 1, 2, 3, 4, 5. Still not worked, call for an ambulance, we keep on going. Eventually you'll hear them be sick, make a noise, or even cry. Okay, so that's what we would do with a choking baby.